Hello, my name is Chris Sloitaire. I'm a registered and licensed respiratory therapist, and today I'll be showing you how to use this G3 APAP device. I'm also going to show you things that need to be cleaned, how to clean, how often to clean, and things that need to be replaced, and when your insurance will pay for certain things that need to be replaced as well. So now, let's start back here at the back of the device. So at the top here, this is where your power cord connects. So now, right in this area, you have a little window that has two filters. And these two filters you need to check once a week in order to maintain clean. When the device is blowing air onto your mask while you're sleeping, air goes into the device through here. So for this reason, these filters are there in order to keep any dust from going onto the device. So once a week, once again, one finger, you pull this little window down and then pull it out. So you have this window that has two different filters. You have this white filter, and then you have this kind of dark gray filter. So you check them out once a week, bring them out, brush off any dust you may have on it, place this down, pick the other one up, brush off any dust you may have on there as well. And then, of course, you're going to place them back in this little window and then back onto the device. Now, before I place them back in there, just want to show you that this particular white filter can be replaced once a month. You'll be given some extra filters to take home with you, so you can replace this once a month. This dark gray filter will be replaced once every 6 months. Now, being that this filter will be there longer before you replace it, if at any point you feel you need to wash it, you can do so with some mild dishwashing soap and some warm water. Make sure you rinse it very well and allow it to air dry. Now, once things are dry and clean, you place the dark filter back onto this device first, and then the white filter goes on top of this gray filter. You have these little tabs on it that will hold the filters in place. At this point, then what you will do is place this window back in here, and then you close it. Just be assured that you don't block this area, so it allow the air to ventilate onto the device. Next, we have this tubing. This tubing, one end will be connected onto the device, and then the other end will be connected onto the message you'll be using. Let's talk about how to clean this tubing before we place it on to the device. So if you will, you put some soapy water in here. Whatever you do for dishes is fine. So you will fill up with some soapy water from here down. And then what you will do is just kind of maneuver the tubing up and down so that the water swishes in from one end of the tubing to the other. Do this for about 2 to 3 minutes. Make sure you remove the soapy water, rinse the tubing very well, and then hang it dry upside down so it can drip dry. That's all you have to do, once a week. Now, the end of the tubing that connects onto the CPAP is this one that has this little cable. This one right here. Now, what you will do, this whiteboard tubing will connect right into here. We start from the bottom and then move up, and it slides right there, nice and easy. This particular cable will connect right into here. However, this cable right in here has some numbers. So those numbers need to face up to the ceiling. And at that point, then you will slide this cable right into this area, and it just goes right in there. That's all you have to do. Let's move to the front of the device. Right here. Just like that. Now, we have this water chamber that you need to put water. Okay, and it's recommended you use distilled water. You can get that at your local store. Just make sure it is distilled water, because not all bottled water is distilled. So now, in order to put water, there's this latch. You put your finger right down in here in the middle, kind of move the latch up, opens up, and then put water into here, up to the maximum level indicated right in here. At that point, then you just kind of close the latch until it snaps. Just like that. While you're using this particular device, sleeping with it, the machine will warm up the water. Of course, you'll be using this device from the time you go to sleep till the time you wake up, hopefully several hours. As the device is warming the water for several hours, the water will eventually evaporate. So that humidity that evaporates will be delivered to you onto your mask, and the purpose of that humidity is so that your nose does not get dry. That is the purpose of the water. So when you wake up in the morning, the level of the water in the water chamber will be lower because it used up some humidity. So on a daily basis, all you have to do is kind of refill it right back up to the maximum level. So you have enough water for the next night's. So now, this particular water chamber also needs to be washed once a week. And you wash it with soap and water, whatever you use for dishes. So now we need to remove the water chamber from the device in order to take it to the sink and wash. So with the palm of your hand right in this area, what you're going to do is press hard and it'll disengage from the device. You pull it out, take it to the sink, open the latch, wash it with soap and water just like you're washing dishes. Make sure you rinse it very well, shake off any excess water, and then allow it to air dry. This part right here is the heating plate, and that's what heats up this part of the water chamber, and that's how the water gets moved. Now, once the water chamber is clean and dry, then you're going to place this water chamber right on top of the device, just like that. Now, in order to latch the humidifier chamber back onto the device, what you're going to do in this area, once again, with the palm of your hand, you're going to press all the way down until it clicks, and then you let it go. Let me show you. Press down. It clicks, and now the water chamber latches on to the CPAP device. Excellent. So let's move on to the on and off button for the device. So right in here, that little rectangular button right here, this is the on and off button to the device. So if you will, you press down one time, click it, and let it go. You see that little window turn on? And here in a few seconds, you will hear the air pressure right there. You can hear it now. Now, when you have the mask on, don't worry. It is a very quiet device. See how quiet it is? Just like that. Now, this particular screen will eventually go dark. 2 reasons. Some people are very sensitive to light and have difficulty sleeping with any light in front of their face or around the surrounding area. Second, even if you're not sensitive to light, you'll be sleeping. No need for this little window to be lit. So now, while you're using and sleeping with this device, will be adjusting to a pressure that this machine will determine that you will need in order to keep your airway open. So your physician will order a particular window or pressure where this machine will be adjusting while you're sleeping. And while you're sleeping, this machine will be adjusting in pressure. You'll have no idea that that's happening, which is good because you'll be sleeping. Now, to turn off the device, 2 reasons. When you wake up in the morning to start your day, and if you wake up and you need to go to the bathroom. So to turn off the device, same button right here at the very top, you click it and you let it go. As you can see, no more air pressure. So the device is on. When the device is off, right here on the left-hand side of the device at the very top, it says usage summary. So right below it says use time. So it'll tell you how much time you use this device that particular night. So if you put it on at 10 o'clock at night, woke up at 6 o'clock in the morning, that's 8 hours. So it'll tell you here that you've used the first 8 hours. Now, right below it says average treating pressure. So now, within that window where the machine is adjusting in order to provide you with the air pressure that you need, you won't know that that's happening because you'll be asleep. However, when you wake up in the morning, let me just turn this light back on. It'll tell you their average treating pressure. So basically, it'll tell you what pressure you slept with within the window that your doctor prescribed. Then below it, you're going to see 3 letters. AH stands for apnea hypopnea index. Those are the events that you're having while you sleep. So, of course, when you had a sleep study, that it was determined you have sleep apnea and the severity of the sleep apnea, that was the A. So now when using this device is to treat your sleep apnea. So we hope that the AHI will come down to 5 or less. So basically, it'll tell you there, once again, what your AHI on a daily basis will be. And then further down here, it's going to talk about leaks, average leak. So basically, when you have a mask on, we're going to show you how to place this mask on, how to adjust the mask so that if you have any leaks, hopefully they'll be minimal, small enough, so as long as they don't wake you up. However, big leaks most likely will wake you up. And of course, we'll show you how to adjust it. However, we're going to show you how to put on that particular mask to assure that you have small leaks and not any large leaks as well. So that's the information they will tell you. As you can see, the little screen goes off. So just pressing this knob right here, push it in, the screen will light up again. And then right here on the right-hand side, you have a little face, either with a frown or a smiley face, and then you have a point. So depending on how many points it is, it's kind of to challenge you to use this device. You can get up to 100 points. So how do we get more points? On usage hours, you can get up to 60 points. If you use it 6, 7, 8 hours, most likely you may get 60 points. You use it less than that, most likely some points, but not 60 points. Now, the other 40 points come from the AHI and leaks. You get 20 points for the AHI and 20 points for the leaks. So, of course, the smaller the AHI and the smaller the leaks, the more points you get. So that's kind of how you accrue more points. So hopefully you can get to 70, 80, 90, or even 100, depending on what your target would be. You just have to challenge yourself. And of course, then instead of having a little frowny face, hopefully you'll have a happy face. So this is typically what this information will tell you and what it means as well for you. So there are certain things here that need to be replaced. Now, in order for your insurance to pay for these replacements, you need to make sure that you use this device on a daily basis and from the time you go to sleep and the time you wake up. However, that time frame needs to be more than 4 hours per day. If you're using it more than 4 hours per day on a daily basis, rest assured, your insurance will pay for the devices, the replacement devices. So now, the things that need to be replaced in this particular case is the water chamber. Your insurance will pay for another water chamber in 6 months. Your insurance will pay for another tubing in 3 months. Your insurance will pay for the white filters, at least 1 to 2 per month. And the insurance will also pay for the gray filters, at least 1 every 6 months. So once again, in order when you do need supplies, you typically will see a sticker here at the top of where the on and off button. You have a QR code that will take you to our website where you can reorder supplies. You'll ask you for your name, contact information, what type of device you're using, what type of mask you're using, and what supplies you will need. Now, upon setup, we will provide you with some documentation, literature that will indicate what you need to clean, how often you need to clean, and what to use to clean the equipment, as well as the things and parts that need to be replaced, how often they need to be replaced, and when your insurance will pay for these particular replacements. So once again, use it the way I've shown you how to use it. If you need to view this video several times to familiarize yourself with the device, so that way you will be proficient in using it at home, using it to treat your sleep apnea. If you have any questions, please give us a call at the office. And my name is Chris Sloitaire, and call me at 726-444-5217, or you can call at our general number, which is 210-614-6000. At this point, this is all I needed to do to cover how to utilize this equipment at home. Thank you very much, and I hope you sleep well.